The International Day of Zero Tolerance for Female Genital Mutilation, FGM, observed annually on 6 February, provides an opportunity to highlight progress and raise awareness to end the harmful practice of female genital mutilation. Today, I have Mrs. Mary Yisa, the Director of Planning, Research and Statistics for Niger State Ministry of Women Affairs and Social Development, and also the gender-based violence focal person. She's here today to tell us about female genital mutilation. Welcome to our studio, Mrs. Mary.
Thank you.
Okay.
My pleasure.
Yes. The first thing I want to ask you is, what is female genital mutilation?
Female genital mutilation, in general, can be seen as a harmful practice that involves the partial or total removal of external female genitalia. It's often performed without anesthesia, locally of course, and all this can lead to severe health issues. We know that FGM, short of female genital mutilation, is a kind of cultural practice, never carried out in the hospitals. It's normally done for certain cultural reasons, and the sad aspects of it is that it leads to several health issues.
You mentioned earlier that it is the removal of something. I didn't get you clearly. It is the removal of?
Removal of external female genital. That is what is popularly known as clitoris. Yes, clitoris. When a part of it is cut off or is removed totally.
Why is that removed?
People tend to remove this for the fact that they don't want their children to be promiscuous. So to say, culturally, they feel not female genital of children are not removed. They will become promiscuous. They will not stay in their husband's houses. They will be following men here and there because sexual activity will be increased. So culturally, they feel removing it is a way of controlling them and making them to stay in their husband's houses, or as children not to feel attached to any kind of sexual intimacy.
So do we see that the reason why FGM become a practice, did it achieve what it was meant to do? That is to stop women from being promiscuous and to avoid any form of sexual intimacy.
It's not stopping anything, because looking at it, the reverse is the case. They thought they've achieved it, but they've removed something greater in the bodies of these children. They thought they stopped these children from deriving sexual pleasure, not knowing that what has entered into their body is far worse than what they are trying to prevent. Yes, it is true that these children may not feel any kind of sexual pleasure, but they become withdrawn. Even after marriage, they become withdrawn. They don't have any kind of attraction for their partners. It's a method that controls and leaves women with lasting mental and physical scars.
So female genital mutilation started some 9,000 years ago. I want to know whether it's still being practiced till today, and where do we mostly see it in Nigeria?
It started, as you rightly said, long time ago and deeply rooted in culture. It is because it is deeply rooted in culture that it is still in practice. In Nigeria specifically, we can find it in the southwestern part of the country. It is much more prevalent there. States like Oyo, Ondo, Ekiti. And then we have another high prevalence in south-south, such as Akwa Ibom rivers and Cross River. Southeast, such as Anambra, Ebonyi, and Imo. Surprisingly, states like Sokoto, Yobe, and Borno have low prevalence.
So what is the immediate health risk for girls when they undergo FGM?
The immediate health risks include risk of diseases. Number one, what is the first thing that comes in mind is the pain, because they don't give anesthesia. They give no anesthesia at all. So victims feel great pain and shock. This shock doesn't leave them early at all. And then we have excessive bleeding, infections, such as tetanus and even HIV. Those are some of the immediate health risks. Urinary retention. Oh, hi. It's better had than seen, because we've been seeing some cases that their parents are even regretting. It can even lead to death, you know. Sometimes the surrounding tissues are affected. Remember that these people that are having this they are not medical practitioners.
Yeah.
So they do it anyhow. It's just the same thing as removal of what we call this one from the throat. Something
Okay,
like that.
tonsillitis.
Tonsillitis. Before you know, they say, hey, this child is having this, and then they will take him to one old man for removal. That is exactly what is happening during female genital mutilation. It's a very cruel way which can lead to death, because when a child bleeds excessively, what do you expect? It doesn't stop there. It has some long-lasting effects also, which can lead to infertility. And then you know that some people are justifying it that at least they can be taken to hospital now. Even medically, it shouldn't be done at all. There's something we call post-traumatic stress disorder, PTSD. They are carriers. Trauma. They live with this trauma. And I want to give you an example. We were giving a lecture on FGM one day, and two women were with me. One was weeping. Madam, what's the problem? She said she regretted her action. What did you do? She said she practically held her daughter and asked the local man to do it, to circumcise her daughter, and looked at her. Why did you do it? She said, she thought it was the best that time. Another woman said, up to date, the daughter is asking her, Mommy, was I circumcised? Mommy, was I circumcised? Anytime she asks, she will just dodge the question and go and cry in the room. So it's not a thing that somebody should just go for at all because of the effects.
Yeah, and another thing that makes it really grave is that this is a procedure that is done for non-medical reason. And you also mentioned they do not use anesthesia. I know that anesthesia is, a chemical that is being given during surgical procedures to reduce the pain that is gotten from surgeries or medical procedures. What does Nigerian law say about female genital mutilation?
Nigerian law prohibits it to the core, especially our VAP law. Thankfully, almost all states have domesticated the VAP law, that is the Violence Against Persons Prohibition Act, rather. Almost all states, only few states have not domesticated this act, and it stands against FGM. It calls it, in fact, it's a criminal offense, punishable up to 4 years in prison or a fine of 200,000 naira for the offenders.
Yes, do we see cases where this law is being implemented, or people that witness another child or a girl undergo FGM go to the police to report these cases? Is it something that is constantly being reported?
It is being reported. The implementation is the issue. People hardly know their rights. It is when sensitizations are ongoing now that people tend to say, oh, so this thing that was done to me is wrong. I think I need to report. An aspect of it, is FGM is an aspect of violence. GBV, gender-based violence. It's a form of gender-based violence. So wherever we go for sensitization of gender-based violence, we mention it categorically. And that is when people will start to know that, oh, so this thing was done on to me. That's why I don't feel this. That's why I don't feel that. Remember the two examples I gave you earlier on. Because of sensitization, that these people got to know that they've done their children evil. And they regretted it. But coming out now, they told me, yes, but it's already passed, that there's no way we can, they are regretting.
Yeah.
And they are even advocates now. So how do we punish them? It's difficult for people to come up. And now that more sensitization are ongoing, especially things like this zero tolerance on the cyst, it will help people to speak out. At least those that have been carried out will not go forward to mess it on others. And they will pull others to please stop it, because it's a great evil that can ruin the life of children.
You have mentioned a mother that regretted taking her daughter for this procedure. What role do women and mothers play in stopping this harmful practice?
Mothers can play a crucial role, as I mentioned earlier on, in stopping this female genital mutilation, especially women that practically use their children to go through this crude method of circumcision. So they can refuse, practically, they can refuse to subject their daughters to this practice. They can serve as role models to others. I did this and it is wrong. Please don't do it. Such mothers can form associations of women that advocate to others everywhere to stop this evil. They can go on to educate themselves and others about FGM's harm. Any initiative that has to do with FGM, female genital mutilation, they should just key into it. I mean, mothers now can key into such initiatives because they've known that it's a harmful practice against females and that it has greater disadvantage or greater disadvantages. Another thing, that a woman is so powerful and a woman can go a long way influencing the community leaders. The women leader, the youth leaders, the women leaders and other leaders can go to meet the village heads, community leaders and advocate in collaboration with other non-governmental organizations, other CBOs, that is the community-based organizations, faith-based organizations, to preach against these gender-based violence. Women can equally, or mothers can equally provide emotional support for girls or for survivors. Those that are already into it, they can put them together, draw them closer because they are already traumatized. Draw them closer with love so that they will be counseled and they will get themselves that it is not the end of the road.
Yeah.
I think that will go a long way.
So if a parent is listening right now and feels pressured to cut her daughter or his daughter, what would you say to them?
Pressure to cut their daughter?
Yes.
Ah, wonderful. I'm sure with all these that we've discussed and the parent that is listening will not be pressured again. But if at all, after these discussions, a parent is pressured to go and circumcise, so to say, or cut their daughter or daughters, my advice to such parents, mothers, fathers, is that they should please put a stop to it. Reason being that it has high risks in the life of their children. Their children are bound to live a life of trauma. So you as a parent, if you don't want your daughter to live a traumatized life, never to forgive you. If you want to be at peace with them, so that they will not say, so it's my mother or my father that caused this for me. Please don't do it because it can lead to pregnancy complications. How will you feel after cutting your daughter or after circumcising your daughter and the daughter is wedded? You are waiting to hear the cry of children only for you to be told that, there are complications. How? As a mother, as a father, you will not enjoy that. Because one of the risks is the fact that it comes with real pregnancy complications. It can cause infertility. It can cause a lot of chronic diseases. In fact, even HIV, because of the unsterilized instruments they are using, it can cause a lot of scars, a lot of tissue tears. Why would you want your daughter to face all this? As a listener, please say no to FGM. Say no to female genital mutilation.
Yeah.
Please, it's not good. Don't let your daughter suffer. Allow your daughter to live a free life that they will bless you and care for you. It is somebody that is alive that can care for an aged mother, an aged father. As you are listening, say no to female genital mutilation. It is not good.
All right. There is no glory in suffering. Finally, what can a young woman do if she fears that she may be forced to undergo FGM?
As a young lady, you can do a lot. If you see that you are at a risk of being mutilated or being circumcised, as others put it, please, you can do a lot. Report immediately. You can report to the nearest police station. If you go to a police station, please let them know that you are looking for the gender desk officer, police gender. They are aware. They've been taught of the evil of FGM. Just go straight there. Go to NAPTIP office if it is in your state, please, or in your town, or anywhere you find yourself. report to NAPTIP. All the states have ministries of women affairs. Please enter there. Ask for social development department or women affairs department. Report the case. Ministry of Justice, even education as a student, report this. As a Muslim or you can go to Form 1. As a Christian, you can go to what we can. Please talk to these people. You can talk to a trusted teacher, a counselor, a healthcare provider. All these are what a young lady can do to make sure that she is not forced to do this harmful practice. And then, if you know that you are in great risk, run. In almost all states, we have what is called safe homes. We call them shelters. When you go there, they will keep you safe before calling your parents. They will make sure that your safety matters first. They will keep you safe, ask you questions, what is it? And then after telling them, that's when they will go into action. Even if you have this office in your place, a Sexual Assault Referral Center, SAC, human rights, FIDA, female lawyers, FIDA, we have also legal aid. All these are places that you can run to for safety and to report the case. NAPTIP that, oh, please, this is what they want to do to me, oh, please, and I don't want it, I'm scared. Make sure you are not forced as a young lady. It is not good. It is not good.
Thank you so much, Mrs. Mary Issa. Mrs. Mary Issa is the Director of Planning, Research and Statistics for Niger State Ministry of Women Affairs and Social Development, and also the Gender-Based Violence Focal Person. She has been talking to us about raising awareness to end the harmful practice of female genital mutilation. Thank you so much, Mrs. Mary Issa, for sharing your knowledge on FGM.